Hi, I'm Diane, and I am a clinical exercise physiologist with True Fitness. So, this is the seventh of our mini health workshops as part of our Sláintecare project. And the focus of the topic today is to look at the specific exercise prescription for the treatment and management of arthritis. So, just an important piece of background information. John and I in True Fitness have been commissioned by Leash Sports Partnership to design and deliver a 12-week strength and fitness intervention for adults in Leash aged 50 to 80 years. And this research study, fantastically, has been funded by the Sláintecare Integration Fund under grant agreement number 21. And if you'd like to hear more about the study design and what we're doing, I will present it at the end of this presentation. Just for now, to say that this mini workshop is part of a number of workshops that were created for the participants as part of this research. So what is it? It basically involves inflammation of one or more joints. There are numerous different forms, and most of which are characterized by varying degrees of joint damage, restricted range of motion, functional limitation, and pain. It affects 50% of men and women over the age of 65 years. So that's a high prevalence. It's the leading cause of pain and disability, not just in Ireland, but worldwide. It's associated with reduced quality of life and poor mental health and depression. And because of the pain and the consequences that go with it, it contributes to physical inactivity, which in turn contributes to other conditions like weight gain, obesity, type 2 diabetes, cardiovascular disease, and so on. So there are lots of different types, but today, in the interest of time, we are going to focus on the two main types that are prevalent among our own group of Sláintecare participants, which are osteoarthritis and rheumatoid arthritis. Okay, so it's important to say that this is only designed as a mini workshop. So in terms of the depth of information we can go into, this is just going to be an overview because I really want to focus on the exercise prescription side of things. But osteoarthritis is a local degenerative joint disease affecting one or multiple joints. So it's degenerative, and absolutely, if you don't do what you can to try and help yourself, we'll say in terms of exercise prescription and other things that you may need to do, it is likely that the condition may deteriorate. So it's important to do what you can to preserve the joints that are affected. And what I have here on the left-hand side is an image of a healthy knee, and on the right-hand side of a knee that has osteoarthritis. And if we just have a quick look, so that large bone at the top is the thigh bone, so basically the femur, and the bone at the bottom there is the tibia in the lower part of the leg. And both bones are surrounded by cartilage. So that's represented in purple here in the picture. And the cartilage basically covers the bone, so it provides support, cushioning, so that you don't have bone rubbing on bone and so on. And around all of that again is a synovial membrane, and its function is to secrete synovial fluid into the joint. So the synovial fluid does lots of things in terms of it provides cushioning and it lubricates the joint so that it can move through its full range of motion unrestricted and without pain. But it also does other things like brings nutrients to the joint to keep it healthy. So if we take a joint like so that doesn't have osteoarthritis and we say take it in the normal physically active individual, so what would happen is through activity and especially weight bearing activity, so like walking, the femur and the tibia can compress against each other, and by doing that they squeeze synovial fluid in and out of the joint, and that's a normal process to happen, and this is what lubricates the joint and takes care of it, and so on, and it's what we're supposed to do. And also we'll say if this person is very active, the muscles that surround the joint are strong and they keep the joint functioning as it should. And also if the muscles are flexible, it allows the joint to move in an unrestricted way, pain-free way, and so on. So that's the ideal situation. That's what you would like to see. With osteoarthritis, now there are many causes of this, but one of the causes is insufficient loading or insufficient physical activity. And in this case, you are not causing all of this to happen. So for example, you may not be moving all of your joints through their full range of motion all of the time. Your muscles may be weak, which means they're not holding the integrity of the joint as they should. They may be tight, which can cause, we say, restrictions and compression of bone when it shouldn't be. And the lack of activity is also causing or not causing the movement of the synovial fluid. So the joint is not being lubricated as it should. It's not receiving the oxygen and the nutrients that it should. And all of these can combine into basically degradation of the cartilage surrounding the joint. And as that happens, so as the cartilage wears away, you end up in a situation of bone on bone, which is not good. It causes pain. It greatly impacts bone. It restricts movement. And it really starts this chain of events of osteoarthritis. So in terms of how that would feel if this was your knee, basically then from all of that you would get pain, stiffness, deformity of the joint as well, and functional impairment. So it's definitely going to impair how you move and how you do things every day. So if we look at it from the physical activity perspective, some of the issues that are arising here are muscles surrounding the joint are weak. The muscles may be tight. The lack of activity is having problems in terms of circulation of synovial fluid and so on. And you're going to end up with poor range of movement. So you have a very tight, sore, restricted, weak muscles and joint in this situation. And so therefore, if we work on the opposite, if we strengthen up the muscles that support the joint, if we release the tension that's in the muscles through flexibility or stretching work, if we weight bear, well, to a certain amount, we'll talk about that later, it can encourage the adaptations that we want. And if we work on range of motion so that we get rid of the stiffness and the restrictions, it's basically the opposite of what you're looking at there. So physical activity has a really important role, but it needs to be done in a very specific way and at a very specific intensity so that you cause repair and not more damage. And of course, this is just a generic presentation, and every case is individual. But just for some basic, good evidence-based exercise advice, that's what we will be doing for the rest of this presentation. So the exact cause of your osteoarthritis may not be known. It could be a genetic issue. Obesity for sure can predispose somebody to osteoarthritis. So basically that would be chronic excessive loading on joints, and particularly if you're not very fit or strong, because the muscles that support the joint aren't really doing what they should do. So this can be a problem as well. So in that case, weight loss may be indicated to help alleviate the issues with osteoarthritis. Severe joint trauma can predispose you to osteoarthritis. So unfortunately, if you may have been in an accident or something, you can get arthritis from that. And again, there are things we can do to help ourselves with very specific exercise prescription. The prevalence of osteoarthritis increases with age, and of course it does, because there are changes in the skeletal system, we'll say, and how we move and function as we age. But a lot of that is also attributed to chronic physical inactivity and not moving your joints through their full range of motion and so on. So there's actually a lot we can do about that. It is more prevalent in women than men. And the other issue is chronic insufficient joint loading. So severe physical inactivity is detrimental because activity is required for the maintenance of the joint function and joint nutrition, as we have just gone through. So inactivity is a serious problem for osteoarthritis. Now, the benefit of that is obviously if you get active and if you do the right combination of activity, it can be very beneficial to you. Okay, so the inactivity then contributes to muscle weakness, lax ligaments, joint instability, and of course. So rheumatoid arthritis, on the other hand, is quite different to osteoarthritis. And basically what happens is it's a chronic autoimmune condition whereby your own immune system actually targets your own joints. And it's characterized by a lot of inflammation. So if you look at the picture on the right-hand side, you can see the redness, the swelling, the inflammation. And what happens is that the lining of the joint is targeted and it starts to degrade, and the structure and the bones start to degrade, and you get a lot of inflammation and swelling, and it can become a situation whereby the joint actually becomes completely deformed. And in certain parts of the body, you may even need a replacement. But It mostly affects hands and feet. It can also affect the wrists, the elbows, the shoulders, and the knees. And it can also affect other parts of the body also. So this is something that definitely needs to be managed. And exercise does play quite a role in this, which is a positive thing to know. The cause is unsure. We're not really sure why the body starts to attack itself, but there are risk factors that have been outlined. So, for example, middle age, and women tend to get this more than men. Obesity seems to be a contributing factor, smoking and some other factors, and also family history. So if your parents, one of your parents had it, you may it may increase your risk, but it may not. So there are associated factors, but really we're not too sure. So what we do focus on is, well, what's the treatment, or how can we make sure that it doesn't progress and that we can manage it the best that we can. So, in terms of the treatment of rheumatoid arthritis, it's definitely a multidisciplinary approach. So, there are some things you can do, but then you definitely need help from the right professionals as well. Weight loss may be appropriate. So, if this is relevant to you, it may help in the management of the condition. Regular exercise is essential, but it must be the right type and amount for this condition, and that's what we will focus on at the end of this presentation. You may need occupational therapy depending on how badly you are affected. So you may need help in figuring out how to do the things that you do every day with greater ease. And there are lots of things that are really really simple and really helpful here. So if you do feel like you need to avail of that, an occupational therapist might be of great help to you, and it might be something you'd like to talk to your GP about. You will most likely be on medication, and probably more than one, to help manage the chronic systemic inflammation, and that's what the medication is there for. So your GP will obviously be working with you on that. Total joint replacement may be necessary at some point, or it may not. It depends on the management of it. But just to say that that might be part of the treatment process. Okay, so for osteoarthritis and rheumatoid arthritis, there are numerous benefits of exercise in the treatment and management of the condition. So in both conditions, it's likely that there are issues with weak muscles surrounding the joint, tight muscles surrounding the joint. Inactivity is a problem, as we've mentioned, and definitely need to focus on that. And the good thing is, if you haven't been active, well, then your physical activity can make a big difference to you. Restricted and painful range of movement. So we want to try and use exercise to counteract all of these. So one of the major benefits of exercise is that it will maintain and increase strength in the muscles that surround and support a joint. This in turn takes the pressure off the joint. But in order for you to increase the strength in muscles, you must do strength training to achieve this. So it won't be achieved by something like walking. You need to do strength exercises. Exercise can maintain and increase the flexibility in the muscles surrounding a joint. So this reduces joint stiffness and pain, which is life-changing in these conditions. But again, you must do very specific type of exercise. You must do your flexibility or your stretching, and also your range of motion exercises, which is simply putting all of your joints through their full range of motion, which we do in the warm-up and in the cool-down in our Sláintecare exercise classes. So ultimately, the right exercise training will prevent functional decline, and it will improve your quality of life, physically, and your mental health as well. So it's really, really important in the treatment and management of these conditions. Okay, so a really good place to start for the exercise prescription is the basic FIT principles for aerobic, resistance, flexibility, and balance training. And we have done those in the first four of our mini health workshops for our Sláintecare project. And if you'd like to get access to those, you can contact us and we'll happily send you the links. But if you look here, I've just kind of created a training triangle because it's slightly different for these conditions. So the base of the triangle represents what you should do most of to help these particular conditions, all the way up to the tip of the triangle, which is basically which is important to you, but of least importance in terms of the treatment and management of the condition. So you can see there that flexibility and range of motion work is very, very important, followed closely by strength and balance, followed by your aerobic exercise, and then followed by whatever leisure time activities you'd like to do. So we're going to cover those now, and then I have one slide on special exercise considerations for these conditions also. Okay, so when I speak about flexibility, I'm talking about stretching exercises. And when I speak about range of motion, I'm talking about simply putting a joint through its range of motion. So, for example, if you take the wrist, you can roll it to the left, you can roll it to the right, you can flex it up and down, and that's doing a lot of the movements that the wrist does. And you would do the same for elbows, shoulders, knees, ankles, etc. And all of that is really, really important in keeping range of motion and mobility in joints. So you should do these types of exercises daily. They're so important for this condition. In terms of intensity or how difficult these should feel, it's as tolerated. So this will depend on whether you're having a flare up or not. And so basically you're going to work to an intensity that's comfortable. If you're stretching, you stretch to the point of tension and not pain. So you should never feel pain in muscles when you're stretching or joints. If you do, you need to just back off a little from the stretch and just take it more gentle. So if we're doing static stretching, which is where you just do a stretch and you hold it, the advice would be to hold it for 10 to 30 seconds and then you come out of it, take a rest, and then you do this 3 to 5 times before you move on to the next exercise. Now, there are other types of stretching, but just to keep it simple, we'll just focus on the static stretching for now. Active stretching, on the other hand, would be one example would be if you hold a stretch for like maybe 3 or 4 seconds, you come out of it, then you come into it again and then out. So for example, you're doing within your 30 seconds, you're actually doing the stretch a number of times because you're only holding it for 2 to 3 seconds at a time. That's a form of active stretching. So my advice would be to do whichever feels most comfortable for you, because either way it's going to stretch the muscle for you. There are pros and cons to both, but just in the interest of not making things too complicated for this presentation, if you can just get in your flexibility training every day, that would be fantastic for these conditions. And don't forget, just when we're talking about range of motion, don't forget functional activities like that sit to stands that we've talked about before. So where you start off sitting in your chair and then from there you stand up fully straight and then sit back down again, ideally without the use of your hands, because they're just functional movements that you need to be able to do as we age for functional independent living. So there are the recommendations for flexibility and range of motion exercises. Okay, so your strength training and your balance then. In terms of strength training, it's the same as it is for the general population. So it's 2 to 3 days a week. But to be honest, I would definitely be aiming for 3 in this case, because the stronger the muscles are that surround the joint, the more they can support it. And at least 24 hours between sessions. So there's no point doing resistance training on Monday and Tuesday and then not doing any until the following week. You don't really get the most gains from that. So ideally something like Monday, Wednesday and Friday would be a nice balance. Intensity should be low to moderate. And our Sláintecare participants, of course, use green cards and yellow cards to indicate different types of intensity. But it just should be low to moderate. No high intensity stuff. There's no need for it. Nice and comfortable. In terms of time, simply you're looking at a 30-minute kind of whole body routine. But if you want to get quite specific, the actual guidelines are 8 to 10 exercises that incorporate all of the major muscle groups in the body. And for each exercise, you should do 10 to 12 repetitions of it. And then once you've that done, that's called one set. And depending on your level of fitness and strength, you can progress at up to 3 sets. But if we want to make that an awful lot more simple, just maybe 10 exercises and the total session should take 30 minutes. And of course, nice and comfortable. So you should focus on all the major muscle groups in the body, and you can do body weight resistance. So for example, squats and lunges and things like that we do in our Sláintecare classes. Or you can, of course, you can incorporate bands and very light weights. Again, it just depends on how much, what your training background is, what your status is for osteoarthritis and rheumatoid arthritis. But in general, just make sure that you're comfortable, you're not causing yourself any pain. If you have a severe form of either of these conditions, you may need a very tailored program. So obviously that's what we would normally do when we're working one-to-one, but just this is a generic presentation. So hopefully these guidelines will be of some benefit to you. With the balance work, we would recommend a little bit of balance, at least 4 days a week, but up to most days. And your balance training, as we've mentioned before, and we have created videos and resources to help people if you need them. 10 minutes, 5 to 10 minutes does an awful lot of work in terms of balance, but it is really important to incorporate that in this case. Okay, so aerobic exercise, of course, is very important for health. So, for example, walking. In terms of the training triangle, I put it closer to the top, not to say that it's not important, but just to say, please don't do aerobic exercise at the expense of the others, because the others are really, really important in the treatment and management of these conditions. So in terms of frequency, ideally progress to 5 to 7 days a week. But you just need to be mindful that you may be limited by pain, particularly in periods of flare up. So you need to be, in terms of intensity, keep it light to moderate. There's no need to be working really, really hard and making things very difficult for yourself in this case. And if you're really limited by pain, you can start off with 1 minute bouts of exercise, followed by a rest, followed by another 1 minute. Like we've often had to do that type of work with people. But ideally, it's fabulous to get into a situation where you can get up to your 30 to 60 minutes because you get so many health benefits from it. So it depends where on this scale you're starting, but anything from 1 minute at a time up to your 60 minutes if you can. There should be low joint stress. So we're not going to go jogging and running on this. You're looking at walking, cycling, swimming, dancing, aqua aerobics, things like that are all really, really great. And particularly the non-weight bearing stuff, like the water-based activities, are really good in times of flare up as well, because the water supports a lot of your weight. You still get to do your training, but it just makes things a little easier for you. Okay, so because again, this is just a general presentation, there are some special exercise considerations that you need to be mindful of. And one of the most important is to avoid strenuous exercise during flare-ups and periods of inflammation. So you don't just keep pushing and pushing and pushing with your training, even though because you'd be in a lot of pain in this case. So what we would say is do what you can, but don't make things worse. So anyone who has these conditions knows what a flare-up is. You know when you're having one, and in that case, it's time to do light, gentle exercise. Try and keep getting all of the benefits of your training, but just not overdo it. But during these times, do perform your flexibility and your range of motion training. Just do it very gently. If you're only starting off with training, what we would advise you to do is focus on progressing with duration of exercise. So in other words, adding minutes to your training versus making your training more difficult. That's not the way to go in this case. You're better off to try and increase the amount of time you spend physically active versus how difficult it is. Okay, so intensity should just be moderate. The warm up and cool down is really, really important. And anyone who's in our Sláintecare groups will know that we absolutely do full 15-minute warm ups for all of our sessions, regardless of whether you have a clinical condition or not. But in this case, the type of warm up that we do is starts very low, it's very gradual, and we start with range of motion stuff, and it gives the joints time to get synovial fluid circulating and all of the things that you need to do in a warm up in terms of reducing the incidence of an adverse event for other clinical conditions that would arise. But the warm up and cool down is really, really, really important here. So don't be skipping your warm ups and your cool down. Joint discomfort during and after exercise may be normal for you, unfortunately. Now, discomfort is a very different thing from extreme pain. So you need to be aware of what's normal or what may feel like damage. So a little bit of discomfort is normal, okay? But if pain persists for more than 2 hours after training, the guidance absolutely is to reduce the duration, so how long the session was, and also the intensity. And this, to be honest, this would be a recommendation for most people, especially people who are just starting off training. So what you really need to do is, in your first number of sessions, go as easy as possible so that you feel so comfortable that you feel like you nearly haven't trained. And you progress from there versus you go in and do a session that was way too hard for the level of fitness or functionality that you have, and you're in pain, and it's just a really negative experience. And the consequence may be an adverse event that you really don't want. So the advice is always nice and easy first. See how you go, see how your body responds, and then you can take it from there. Exercise at a time of day when the pain is least severe. If you are someone who's suffering from a lot of pain, and I won't need to tell you when that is, you will know your times of day. So you should put your physical activity in the time of day where you're in the least amount of pain. Please make sure you have appropriate footwear, they're stable and they're comfortable. Weight reduction may be important in both cases of osteoarthritis and rheumatoid arthritis. So it may be something you need to consider, because obviously the lighter you are, the less stress there is on joints. And don't forget about your functional exercises like your sit to stand and your balance training. They're often overlooked, but they have a huge role to play in these conditions and also just in general health and healthy aging. So as always, we like to give our Sláintecare participants some type of practical take-home resource following our health workshops. And in this case, we've just put together a very basic sample 7-day training diary specifically for arthritis. So you can write in the type of activity that you do and how many minutes you do, and then you basically translate it into what it is. Is it flexibility, resistance, aerobic, balance, or what is it? And tick off the sessions that you do to ensure that you achieve the recommended amount of each mode of exercise per week. So hopefully this will be of help to you. As I said earlier, this is actually the 6th workshop that we've done. So in the first 4 workshops, we really in detail went through what balance, flexibility, strength and aerobic exercise is, and we supported these with take-home resources, including videos, home-based training and so on. So if you would like to avail of these and you are not part of the Sláintecare program, that's no problem. You can contact myself, so Diane, or John, our strength conditioning specialist. And so on our website or on our email, info@truefitness.ie. Okay, so finally, for anyone who's interested, so we are currently running a research study titled Prime Time for Middle-Aged and Older Adults, a strength and fitness program for adults aged 50 to 80 years in Laois. And we have recruited 80 participants. They're 50 to 80 years of age. Originally, we were supposed to run this on site, which we love to do, so we get to really know everyone, and there's obviously a lot of social interaction and so on. But of course, with COVID, and because of the age group of this group, and also all of the numerous clinical conditions and injuries and so on that exist, of course, they're of the most vulnerable in society at the moment. So we had to change our study design to move to online intervention, which, to be fair, is probably going to be the future of training interventions for this population for the immediate future anyway. So it's actually a really good opportunity to trial this. So we have participants of all clinical conditions, all abilities, visual impairments, you name it, everybody is in this program. It's an inclusive program, and that's what it was always intended. There's very little exclusion criteria here. We received ethical approval for the study from DCU, so we were delighted with that. And we worked very hard for this to be an online intervention. Okay, so we conducted our pre-program tests at the start of September, and in the interest of time, we ran a battery of tests in small groups, of course, and with all precautions taken to assess strength, fitness, balance, flexibility for physical measurements. And then we did a number of questionnaires to look at mental health, quality of life, how active people are, and a range of other measures as well. And these, of course, were actually done on site because, of course, us as testers, we need to be able to assess these variables, but all precautions were taken in terms of COVID, and all procedures were approved by the DCU Ethics Committee. Okay, so from there we have moved on to our 12-week intervention. And so what the participants do is they train twice a week with us online. So they're all trained up on Zoom, and everyone is using that twice a week to train with us. Each training session is a combination of strength work, aerobic exercise, balance, and flexibility. Because what we're finding is, even for the people who are active, they mostly focus on aerobic exercise. But as we get older, we need all of the components of fitness. So we have all of them incorporated into each training session. So they do that twice a week with us, but they also do one mini workshop with us per week. And in those, we pick a particular topic and we take them through the science behind it in a very, very practical way. And we also support these with take-home resources in the form of handouts or videos or whatever it is that suits that particular workshop. And of course, we monitor everyone weekly. We constantly call people, email people, and we do as much as we can in terms of social support as well, because that's really, really important part of training. So we, at the end of each week, then we email everyone their participant take-home resources. So they're building up a big bank of physical activity and health resources that they can use moving forward. And the purpose of these mini workshops is to teach them everything they need to know that they'll be able to maintain these behaviours in the longer term. Okay. And of course, we after week 12, we will be repeating the post-program tests. This is a research study, so we will be creating a research paper in January of 2021, and we're hoping to publish that in the Irish Medical Journal, so it'll be open access for anybody who's interested to take part. And obviously, this is important to say that we were commissioned by Laois Sports Partnership to do this particular research study, and it's funded by the Sláintecare Integration Fund under Grant Agreement 21.